I'm Gus Bilirakis, and I'm privileged to serve Florida's 12th Congressional District here in Congress. As co-chair of the Congressional Rare Disease Caucus, it's an honor to be here with you during a Newborn Screening Awareness Month to discuss the importance of a well-funded, robust national screening program for babies who may be born with rare diseases. Before we get into this important issue, I want to take a moment to thank my colleague and co-chair and good friend, Congressman G.K. Butterfield, for his tremendous contributions to help rare disease patients and their families. It's been an honor and a privilege to serve and work alongside him for the last, over the many years, actually. While I'm saddened by his upcoming retirement, I'm proud of his good work, the good work we've done together. Really, we've accomplished quite a bit, and we couldn't do it without you and this organization as well. And I remain committed to continue to build upon that legacy of success. As the rare disease community knows, rare diseases are not a rare problem. There are an estimated 7,000 rare diseases which affect more than 30 million Americans. And yet nearly 95% of these conditions have no known treatment or cure. Very sad. With each rare disease impacting smaller patient populations, there are challenges in getting the research and attention each of these patients deserve. Now, in the case of newborn screening, we have the opportunity to make a more proactive approach to battling rare diseases. Currently, 4 million babies are screened annually for at least 31 serious but treatable disorders that are detectable at birth. Of the infants who are screened, more than 12,000 babies annually are found to have a condition that, if left untreated, could cause severe disability or even death. We all want to promote healthier babies and to prevent a child from suffering whenever possible. Early identification and intervention dramatically improve health outcomes for these children. That's why I was proud to co-sponsor H.R. 482, the Newborn Screening Saves Lives Authorization Act, which would reauthorize key newborn screening programs through fiscal year 2026. In addition to simply being the right thing to do on a human level, the newborn screening program saves taxpayer funds in deferred costs of treatment if the condition was left undetected. I mean, that makes sense. The newborn screening program is one of the most notable public health success stories. We must ensure the continuation of this effective program while embracing changes that will allow it to better keep up with the rapid pace of medical advancement, particularly in the field of diagnostic testing. We must also remove barriers that delay newly approved diagnostic tests from being part of the federal recommended uniform screening panel and being able to each state-run screening panel. So added again, it will be being added to each state-run screening panel. H.R. 482 would help better facilitate and modernize these critical programs. There's nothing more precious than a parent holding their newborn baby in their arms. The newborn screening program is a way we give millions of those parents the comfort of knowing that their baby was not born with a horrific disease, while enabling life-saving intervention to those families who need it. As policymakers, we all talk broadly about the need to empower patients and promote a patient-centered healthcare system that allows for individualized care. One of the most powerful tools for achieving this goal is the advancement and availability of diagnostic testing. We must ensure these vital tools are accessible to our most vulnerable citizens and invest the resources needed to ensure the highly effective newborn screening program continues to fulfill its potential. Again, thank you for allowing me to participate today. This is a very important topic, and I just wanted to tell you how much I appreciate you, all the parents and all the advocates for rare diseases. You make my job a little easier. and the companies too, the investments they make, and we are making progress. So we've got to continue and build on that progress. So thank you very much, and I'm sorry that I interrupted the presentation, but this is a busy day for us in Congress. But I appreciate you having me attend today, even though it's virtually. Thank you.